Hi guys, so this month we are doing a little bit deeper dive into COVID, long COVID, and kind of what that all entails. We're getting a lot of questions from our followers about what can they do to help themselves at home if they have long COVID. So long COVID, like we talked about, there is typically a component of autonomic dysfunction. There also can be some other things. So while we don't want to provide medical advice to people that we have not evaluated, there's kind of some general things that patients with dysautonomia do at home that can be helpful for them. But please keep in mind that every person is different, and really seeking help for your specific case is going to be the best way to make sure that the things that you're doing at home are actually helpful for the condition that you're dealing with. But generally speaking, we look at, increasing our water intake, increasing our salt and electrolyte intake, compression stockings, and doing some form of exercise. Now, I want to be clear, this looks different for everybody. So if you are bedridden, that exercise may be just getting your legs moving or getting your arms moving while you're in bed. For others that are maybe a little bit more functional, that may be going out for a walk. Or if you're further along in your recovery process, like you might be doing a CrossFit workout or training for a marathon, right? So that is very variable for everybody, but generally speaking, with long COVID, those are some recommendations kind of across the board that we see people utilize that may be helpful for you. But like I said, if you have other things involved in terms of like the inflammatory process, if you have actually true pathological cardiac things going on as a result, right? Like those all play a role in what might be specific at-home instructions for you. So again, we always encourage you, find a provider that knows about these things, that can help understand what is actually going on, what's the root cause of what's going on, and address you as a whole person so that we can treat every aspect of dysfunction that's going on in the body. I hope this helps. As always, you guys are driving these videos, so please make sure to like, comment, subscribe, share, and follow along on all of our platforms so that we can provide you more information. Appreciate it, guys.